Hey everybody, thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi, joined by our 9 News health expert, Dr. Payal Kohli.
Hi, Chris.
Dr. Kohli, thanks again for being with us today.
My pleasure. Glad to be here.
And so there's been some news as of Monday night. Masks are no longer required on planes with a bit of an inconsistent message from a federal judge. That's not what we brought you on for about the political side of that, but what we want to ask you about is masks on planes. A lot of people seem to be taking them off. What would be your recommendation about that?
And you know what's interesting about planes, Chris, is that people are coming from lots of different places. They're gathering, and they're sitting for prolonged periods of time in close contact with each other. So I think in a way it creates a slightly different environment. Now the nice thing about planes is that the air often gets filtered, but trains and subways and buses and other forms of public transportation have sort of the same problem. So in an individual level, taking a mask off on a plane, especially if you're vaccinated and boosted and pretty healthy, is probably pretty low risk for you. But my concern is mainly more for those that are left behind, so to speak, are kids under the age of 5 who are not yet eligible for vaccines, our immunocompromised patients, those that are particularly elderly, because yes, they can still keep wearing their masks, but if you take off your mask, your risk to expose them is certainly higher, especially against a background of cases already starting to tick up, and us being in the right window where our immunity from the boosters and our immunity from that wave that we had in January is really starting to go down.
Well, okay, so it sounds like planes have that high filtration system. My understanding about it, again, glad to have you on to explain this, is that planes are actually relatively safe because those air systems are filtered through. But could you explain in a bit more detail about how you're putting potentially other people more at risk by not wearing a mask?
So essentially, as we know, especially with Omicron, you can have the infection and not have symptoms. Especially if you're vaccinated and boosted, the likelihood of you being asymptomatic is potentially even higher. So let's say you are harboring the infection and carrying it, especially with these new variants from all over the world, and you have international airlines like United and Delta that have gotten rid of, mandatory masks, we might be getting new variants infusing in. So if you're carrying the infection, shedding the virus, and you're not wearing a mask, in the people sitting around you, the row in front of you and the row behind you, you're essentially exposing them to risk just by breathing. Now, of course, coughing, sneezing, eating, talking, all of those things aerosolize droplets even more. But even just by breathing, you're actually exposing the person right next to you to risk, and you're all sitting in a closed container. So even though the air is recycled about every 4 minutes or so, in other words, fresh air is put in and there's HEPA filters and everything, the viral dose that somebody sitting right next to you might get if you're infected with something and shedding it is potentially pretty high. So my advice would be, if you're somebody who absolutely wants to take that mask off, I guess you can take it off if you're vaccinated and boosted. But if you're sitting next to someone and you see that they have a mask on, out of respect and courtesy for your fellow passenger, not knowing their medical history or their situation or who they live with, maybe think about putting that mask on just out of respect.
Let's say you're on a plane, and I keep asking these questions just because obviously this is maybe a bit of new territory now. Let's say you are wearing a KN95 mask on a plane, and somebody sitting next to you without a mask. What's your risk as the person who is wearing a mask about contracting the virus?
So much lower than if neither of you was wearing a mask. So we say, two unmasked people are the highest risk for exposing each other. If one person's wearing a mask, I am more protected. You're also protected from me because of me wearing the mask. But as you know, none of these masks are 100%. And the KN95, especially if you've worn one, it doesn't fit quite as tight as the N95, which has straps around your head, so you can get air leaks. And that's really how the exposure kind of happens with those air leaks that can occur around it. So if somebody's sitting next to you, like I said, was infected, not wearing a mask, and coughed or breathed heavy or talked in your direction, and you happen to inhale before that recycling of the air occurred, you could very easily get infected. Now, again, reducing your risk is multifold. So you want to, of course, if you're planning a travel or trip later this year or this summer, go and get that booster if you're eligible, because we know that that booster really augments those neutralizing antibodies and really helps to fight off the risk of symptomatic infection.
Well, speaking of boosters, and you kind of alluded to this at the beginning, was boosters, a lot of people got them in November and December and January. We're now in April. So a lot of those immunities may be starting to wane. I think you alluded to that already. What is the risk for somebody who's been boosted and vaccinated, but now that immunity from that booster maybe starting to wane. What's our overall risk to this virus at this point?
So the risk of getting in the hospital is still quite low, because what we think is that even though your antibodies have gone down, which are kind of your frontline surveilling soldiers, you still have T cells, which are other types of infection-fighting cells, and antibody-making cells that live in your lymph nodes that can wake up if you were exposed to the infection. The risk of getting an infection is a lot higher. So symptomatic infection is what you're at risk for now, not so much ending up in the hospital. Now, someone might say, well, what's the big deal about a symptomatic infection if you're not going to end up in the hospital and you're not going to die from it? And the answer to that is really long COVID. And not just long COVID, but we're also learning based on new data that even a mild index infection, like your illness was just mild, you just had a cold or a headache, can result in long-term, lifelong complications like diabetes, congestive heart failure, arrhythmias, coronary artery disease, because it causes inflammation of the blood vessels. It causes inflammation in the pancreas, which is the organ that makes insulin. So even though the illness itself might not be bad, you might be dealing with the consequences of getting that infection for a long time. The other reason you don't want to just go out and get the infection, and we want to make sure we all work together to do this, is because infection begets variants. The more infections people get, the more variants we're going to get. And it's just a matter of time before one emerges that puts us right back at the beginning where the vaccines don't work and got to go back to everybody masking. So those are the two good reasons to try to really minimize the number of infections out there by not just, washing our hands and doing all the mitigation measures, but also trying our best in crowded public spaces to wear masks just like the CDC recommends.
Is there data on how many people, what percentage of the population contracts so-called long COVID?
It's variable based on the variant.
Right.
So we're learning a little bit, and it depends a little bit on how severe the initial illness was, what the background is, but there is some studies that say up to 1 in 3 people can have consequences of long COVID. And that, some people say, may even be an underestimate because a lot of people had COVID and didn't get diagnosed with it or didn't realize it, and then they end up presenting with diabetes or what have you. So we may even be underestimating the degree of kind of long-term consequences. What we know about this virus is that it isn't messing around. It isn't just a respiratory virus, and it isn't just a cold, like old versions of the coronavirus were. It actually can cause long-term consequences for us. And so I want to take it very seriously, even though we are in a phase now where it's going to be around, we're going to live alongside of it, but you want to try to do your best to not get infected if possible.
By the way, anecdotally, and I know as a doctor, probably the last thing you want to hear about are anecdotal stories. My best friend got COVID almost 2 years ago, and he's got maybe 20% of his smell still. He can't smell and he can kind of taste, but
well, and we talked about cardiovascular effects and diabetes, but there's shrinkage of brain tissue that occurs after COVID. You actually get atrophy of your brain. We don't know if that's reversible or not. Of course, the brain fog and the trouble concentrating can happen. As a cardiologist, I'm seeing 20, 30-year-olds in my office all the time who are unable to walk up a flight of stairs or ski down a mountain like they used to.
Wow.
Because they just have what's called a dysautonomia. The nervous system got affected, so their heart rate shoots up every time they try to do anything, and they get short of breath. So really this, like I said, is, we all have anecdotal stories, but even the literature tells us that this is a real thing and it's happening on a population level.
Fascinating information there. Fourth shot, what do we know about the effectiveness of it? And it's obviously recommended for people 50 years old or older. Again, what do we know about the fourth shot at this point?
So basically what we know came out of data from Israel, because Israel did this on a population-wide level. And what they saw is that people who received the fourth shot had a boost in their neutralizing antibodies. Those are those frontline soldiers. They had a boost in other types of infection-fighting cells as well. And they had a protection against severe hospitalization and illness. And that was even true with the Omicron variant, so not just the old Delta variant, which made people sicker, but even the newer, milder Omicron variant. And so that was data from Israel based on 60 and above. Now, the CDC here has extrapolated that a little bit to 50 and above, just sort of saying that people who are 50 and above may be at higher risk for getting sicker because we know that the immune system gets a little weaker as we get older. And so that's how they made that cutoff. They also, of course, know that those that are immunocompromised don't get a normal immune response to the first 3 shots, and hence they need that fourth shot to really kind of help them get the catch-up protection that they need. So currently the fourth shot is recommended for those that are immunocompromised for any reason, regardless of age, and those that are 50 or older. And if you're somebody who's younger than 50 but has really high risk medical conditions, I think you might want to talk to your doctor about individualizing whether the fourth shot is right for you. But really it helps protect us against getting in the hospital. Now here's the kicker, and the reason that experts are divided on whether people should get a fourth shot or not is because we don't know how long that protection lasts. Some of the preliminary studies tell us that the peak protection occurs 1 week after you get that fourth shot. That's when you're peak protected. But by about 4 to 6 weeks, your protection against symptomatic infection really starts to go down. And by about 8 weeks, your protection against symptomatic infection is nearly gone, is nearly back to where it was in the beginning. Now, you're still protected against severe illness and hospitalization. And that's why some people say, well, we should still do it because that's the outcome that we fear the most. But those antibodies are going to keep going down. So how many more times are we going to keep doing the same thing? So my hope as a physician is that we get some Omicron-specific vaccines out there that we can really utilize to help create a much more targeted immune response and to anticipate what the next generation of variants is going to look like so that we can really start being more proactive and less reactive.
You said that we're getting into a phase where we're going to have to live with the virus with us, basically. Is there any sort of hope or any sort of idea that we could potentially have a vaccine that mitigates the spread of it at all? Like, I think about like the polio vaccine, for example, which basically wiped it out. Is it too late for that, or what's the possibility?
So I think eradication is probably unlikely.
That's the word I was thinking of, yeah.
Yes. So it's unlikely that we're going to completely eliminate like with measles, for example, because in order to have eradication of something, you need to have a few basic scientific criteria met. One, the vaccine has to be very effective, like greater than 90% against any infection. Two, that protection has to be lifelong. So measles vaccine offers protection for a long time. We don't see that with this vaccine, which we know within a few weeks or months it starts to already go down on protection. And then third, you really have to reduce the number of active infection cases and get everybody vaccinated or immunized through infection. So get that herd immunity threshold met before the next variant comes. In this case, the virus is evolving so quickly that by the time we play catch up to the current variant and maybe start to get immunity to it, we've already got a new one that evades our immune system and what have you. So I don't think we're going to eradicate it, but I do hope that we can get it to a low level of background transmission, which we're not seeing right now. It's starting to go right back up in the wastewater with our positivity rate going up. So we're back in that upswing sort of phase. And every time the virus does something, Chris, we have to do something. So when the virus moves, in other words, the positivity goes up, the wastewater cases go up, we need to amplify our mitigation measures, either through increase in boosting, either through more masking, either through public, social distancing. And if you look at what we're doing, we're actually kind of doing the opposite. The virus cases are going up, and now we've just lifted the mask mandate on airplanes. So the timing, to me, seems a little bit off.
So I guess this is the way I always kind of like to end things a little bit, is if you're vaccinated and you're boosted and you're within the kind of middle 50% of health, how should you be caring about your life right now?
I think that you should feel pretty okay about going to events, going to dinners, going out, given the current state of affairs, given where we are with our positivity right now. You should feel fine if you're average risk and a healthy individual who's vaccinated and boosted. My personal take is that if you're going into a public space like a shopping mall or a sporting event or an airplane where you don't know the vaccination status of others, you don't know where they're coming from, the safest thing to do would be to put that mask up. But even if you don't wear that mask, you're probably okay. Now, if you live with somebody who's immunocompromised, somebody under the age of 5, somebody who's elderly, or you have a high risk of exposure because you work in a hospital, those are the times you want to really amp up those efforts to wear that mask, even when it's not required, because it's going to protect you and it's going to protect others.
Okay. Dr. Kohli, as always, thank you so much for your insight and giving us an idea as we continue. As you mentioned, this virus seems to be very, very quick in terms of how it affects our day-to-day life, and obviously a new twist this week with the lifting of the mask mandate on planes. So, Dr. Kohli, thanks so much for your time today.
My pleasure, Chris.